With my colleagues and indeed the whole House in support of this bill, but putting on record, Mr. Speaker, that I do so with some caution. No one would question the purpose of the bill, the establishment of the Health Quality and Safety Commission, and a mandate for collective purchasing, which, as the Minister says, is going to save, I think the claims, some $700 million in savings. Certainly these sound like very appropriate purposes, and of course to have a system of arbitration when there is conflict or disputes over shared services. So, Mr. Speaker, in terms of planning of health services within our hospitals, no one in this House would argue about efficiency. In fact, Labor in government made many moves to ensure that the health system was more efficient. But certainly we on this side of the House, Mr. Speaker, do have some caution, and very appropriate caution, given often the Nationals' history in just this term of government. I want to congratulate, as my colleagues have, Kevin Haigh in terms of the amendment, the successful amendment that went through, in fact, without debate, Mr. Speaker. So well supported was the amendment, and that was in terms of ensuring that the Commission was not to remove that requirement for the Commission to be self-funding, because again, and I would like to quote from Kevin Haigh in his report, in that the concern that usually with the best of intention, but there could be an incentive for service providers if they have to pay for quality improvement programs and also have a constrained financial position, which is indeed the case under this government, Mr. Speaker, then they may well choose not to pick up all of the programs. And whilst we hope that service providers would usually prioritise quality and safety over financial cost, the reality is that this will only occur through the ethics of the providers and their personnel, because the incentives are generally set up in the system to focus on the dollar. And I want to say that to Kevin Haigh, I think that that is very wisely put, and certainly that I agree. And if we look at some of the, or if we consider some of the cuts of programs that we have seen in this short time that this government has been in power, I would certainly agree with Kevin Haigh on that, and reiterate how important it is to have those checks and balances. Also, in terms of the consultation, that I want to say that along with the checks and balances in terms of providing the best quality health services, which is what every New Zealander is entitled to, that I certainly am in agreement with the Health Women's Action Trust, that we're really concerned that consultation with communities should not be viewed as a nicety, but rather a fundamental part of the public health and disability system that ensures that health and disability services are appropriate for and responsive to all of those that need them. So this, the purpose of my address this afternoon, Mr. Speaker, is to put the government, and I say this along with my colleagues, that to put them on notice in that we will be watching, we will be monitoring, and we will be ensuring that we don't see this brought in at the cost of consultation and the cost of provision of quality services to people. Because, Mr. Speaker, and I'm going to talk about, one may say, well, why would you have these concerns? Well, I think if we only look at National's record, we see a distinct change under this government. From under Labor we saw, or with Labor we saw, a government that was about promoting wellness in health, the very successful primary health organisation, ensuring that doctors' visits and primary health care across the board is affordable and that it was contained at an affordable level. Very disappointing to see, Mr. Speaker, that is now not the case, that we see costs creeping up, and we have seen real cuts to the most to primary health initiatives that actually do promote wellness and do prevent major cost, to say financial cost, to say nothing of the cost to people's quality of life later down, or indeed the ultimate cost, the cost of their life, because those supports, the promotion of health initiatives has not been there at the important times. And members in the House may say, or if the government was to say, well, where would you see that? I would be asking for extensions to the speech to go through all the cuts we have seen. But if we look at in terms of obesity, Mr. Speaker, we are on this side of the House are not on the view that if we can go back, that in terms of promoting wellness. Promoting wellness is very much part of what should happen in primary health or in our health system. And if we look at programs such as, and I know that DHBs are responsible for funding many of these programs, whether it's about drug, alcohol abuse, whether it's about dependency, whether it's about things like smoking cessation programs, which are absolutely vital in terms of the health and safety of our nation. Cuts in these areas, mental health services, the dramatic cuts to funding in those areas has seen, we know that we will be paying the price much further along the way, and that with the best will in the world, that the purpose of this bill, establishing Health Quality and Safety Commission, that many of these cuts have been actually at the cost of health and safety to all New Zealanders. So there is a certain irony there. Mental health services, something that is really important to invest in. Healthy eating programs, if we look at initiatives that often provided or funded through the DHB, that we see cut. Healthy eating programs in school, the fruit in school, sexual and reproductive health services, support for Alzheimer's, all of these effectively getting the chop. So it is with some misgiving, it is with much concern, and I can see Paul Quinn over there sharing his concern as well. Paul Quinn is someone who does often he doesn't act entirely in a partisan way. He often has the courage to speak out and say, I agree with the opposition. I agree in this instance that that there are concerns about what is being cut, certainly in areas that we've seen that we see these cuts. So, Mr. Speaker, we in Labour, we will be we are putting the government on notice. We will be monitoring this efficiency. We believe that if we got our calculators out and looked at the millions in savings at the moment that this government's brought in, it's about cuts to services, cuts to vital services that should be provided, and that these savings of efficiency cannot be at the cost of quality. So, Mr. Speaker, that certainly this bill is supported. It is enhanced by the Green Party's amendment, and I congratulate Kevin Haig. He's had lots of accolades today in the House, and I think that's very fitting. And so that, along with my colleagues, I do support this bill, but certainly on notice that we, and I know the very hard-working members on the Health Select Committee, will be taking a real interest in this bill. So thank you very much, Mr. Speaker.